So let's move on to our speakers for this evening's session. Dr. Susie Collar-Palmer is a senior lecturer in health psychology in the Department of Psychology. Susie's research interests her in the areas of health psychology, clinical health psychology, and applied health research. During the current pandemic, Susie's conducted research relating to mental health as well as vaccination intention. Dr. Liane Azevedo is a reader in health research. Her research interests are in public health and behaviour change interventions. She's been involved in many studies involving interventions, particularly with children, targeting increasing in physical activity and the reduction in sedentary behaviour at schools. I'm delighted that we're joined this evening by Rebecca Elliott, Public Health Manager at Kirklees Council. Rebecca leads on mental well-being and suicide prevention agenda. During the past year, Rebecca's been working with partners across Kirklees, mainly to increase awareness of mental health support in communities for vulnerable groups, as well as increasing the support for people suffering from grief and bereavement across West Yorkshire and Harrogate in partnership with the Integrated Care System. In this webinar, Susie and Liane will discuss their research on mental health and COVID-19, and Rebecca will discuss what this has meant in practice. We'll have time towards the end of the webinar for questions, so please pop any questions you have or comments in the Q&A box. I'll now hand over to Susie.
Thank you, Anne. Now I'm going to screen share everyone. Just bear with me. That's wonderful. I hope you can all see this. To start us off with, I will present some general background statistics, and then I will hand over to Liane and Rebecca, who will talk about more specific details. Oh, and for whatever reason, it is not working for me. Hang on, give me one more moment. I will start again. There we go. Sorry about that, apologies everyone. The COVID-19 crisis, as I'm sure we're all aware of, has heightened the risk factors generally associated with poor mental health, financial insecurity, unemployment, fear and worry about COVID itself, while the protective factors that we usually can rely on, such as social connection, employment and education engagement, access to physical exercise, daily routine, and access to health services fell dramatically. And what this led to was a significant and unprecedented worsening of population mental health. So the first graph I've got for you here is the results from the UK Household Longitudinal Study. It allows us to compare psychological distress in the 2 years leading up to April 2020. Actually, it goes back further than that, but I selected the last 2 years prior to April 2020 just to not clutter the screen too much. What we can see here is that the distress scores on average increased from 2019 to April 2020. We can also see that for women, represented by the blue line, on average have greater increases in psychological distress relative to men, which are the orange line, due to the pandemic and the first lockdown. This second graph is showing us the proportion of clinically significant distress. In other words, the percentage of the population experiencing psychological distress significant enough to cause serious problems in life, whether it was social, occupational, or other important areas of functioning. Again, it's clear that in April 2020, during the first lockdown, the proportion of individuals who would qualify for a clinical diagnosis of depression or anxiety increased from previous years, and more so in women than men. I think it's important to point out that the substantial increase in mental health distress in the UK population has not affected all groups equally. So while we might all have been in the same storm, we've not been in the same boat. Established health inequalities persist, with prevalence of mental distress higher in people with pre-existing health conditions, those living in low-income homes, and what this study here demonstrated was people of Asian ethnicity. They also found that the pandemic led to new inequalities in mental distress. such that those living with young children, in particular mothers, and those in employment at the start of the pandemic, were at increased risk of larger increases in mental distress. And this has also been demonstrated in other studies. And additionally, young people, women, those from more socially disadvantaged backgrounds have also been shown to be at increased risk of mental distress during the pandemic. Our own research, which Liane will talk about more shortly, conducted with much smaller samples than these very big studies, are also in line with those findings. If we move on and have a look at what happened as we moved from the spring and the first lockdown in March 2020 and into the summer and the easing of the restrictions, what we see here is the first 20 weeks of the pandemic. Let me just go through the key dates here for those of you who may not be from England. March the 23rd signalled the lockdown, so the first very strict lockdown that we had last spring. May the 10th, it was announced that the strict lockdown was being eased. On June the 15th, non-essential retail was reopened, and on July the 4th, further public amenities were opened. The blue line represents depressive symptoms and the red line represents anxiety symptoms. And what we can see here is that there is a reduction in both depressive symptoms and anxiety scores in these 20 weeks. The largest reduction is in those first 5 weeks of the pandemic. And then you can see there's a plateauing of symptoms after July the 4th. So as further lockdown easing measures were introduced, there was a plateauing of this reduction in mental and psychological distress. What these authors found was that being a woman or being younger, having lower educational attainment, lower income or pre-existing mental health conditions, those living alone or living with children were all at risk factors for higher levels of anxiety and depression at the start of the lockdown. Many of these inequalities and experiences were reduced as lockdown continued, but the differences, this is important, were still evident 20 weeks after the start of lockdown. What these data suggest is a process of adaptation throughout the pandemic. While this is positive, we do know from previous natural disasters, pandemics, and other emergency events that these problems are likely to persist in the medium to the long term. It's therefore really important that we keep mental health needs at the forefront of pandemic recovery. That begs the question, what can we do if we're still experiencing stress or anxiety relating to the pandemic? We're on this continued roller coaster. It's not seemingly letting up anytime soon. There is no one size fits all when it comes to coping with these kinds of events. What I've got on the slide here are just the basic building blocks of good mental hygiene. So keep a routine, look after yourself, consider how well you eat, how well you sleep, and how much exercise you get. Limit social media and how much news that you consume, because too much negativity, too much bad news is really detrimental to mental health. Connect with people. So reach out to your social networks and your family members that are supportive. Don't be afraid to ask for help if you need it. Importantly, as much as you can, try and control what you can and let go of those things you worry about that you are unable to control. Also, in the ways forward, it's not just about individual psychology. What I think the pandemic has really highlighted is that this divergence in mental health effect of the pandemic is of a very serious concern. It points to the need for a response and recovery plan that is multifaceted and addresses not just the provision of mental health services, but also the social determinants of mental health and a reduction in socioeconomic inequalities, so that we can minimize even the extent of mental health problems that might persist after the crisis. I will now hand over to Liane, who will discuss the results of the study that we worked together on.
Thank you, Susie. I just gonna share my screen now. Just bear with me. Okay, so I hope you can all see my screen. So, hi everyone. So just following up what Susie said, last year we conducted this study where we looked to the impact of sitting time and physical activity on mental health during the COVID-19 pandemic. I believe that you're probably going to be receiving in the chat box the link for the full paper, so you can access and read it calmly later if you are interested. So I just want to also say that Matt Pierce, who was a PhD student of University of Huddersfield, also took part of this study. So it might be still very fresh on your head. March last year, when we went to full lockdown, and Susie clearly explained to you all the stages of lockdown. So we had roads that were completely desert, as you can see here. And this first lockdown, we lasted between March 30 and April 30. The only two things that we could do outdoors were going to the supermarket, which you might find exciting, and doing exercise. And for me, this was the highlight of the day. And coming from a background of physical activity and public health, I really welcome this policy from the government. And I think it was a huge recognition for the benefits of physical activity for our physical and mental well-being. So there is a lot of literature about the benefits of physical activity and mental health. We know that it reduces anxiety, depression, and negative mood. We also know that the opposite, sitting time, sedentary behavior, have a negative effect on depression. However, during COVID pandemic, many studies show that there were an increase in physical activity and an increase in sitting time. And this has shown an associated negative effect on well-being, depression, and anxiety. So between May and June last year, which corresponds to phase 1 of the lockdown and phase 2 of the lockdown. So phase 2, we had a little bit more freedom than what we had in phase 1. In phase 2, we were allowed to meet up to 6 people outdoor, and we could exercise as many times as we want. So this study was conducted between these two phases. So we had 284 participants. We had a relatively young sample, 33 years old. The majority were female, white. Because we use a lot of our university connections to advertise the study, we had a good proportion of university students in our sample, mainly healthy, and just 20% was inactive. I also want to say that in our analysis, we tried to control to see if there was any effect on our variables on difference between participants who were recorded on phase 1 and participants who were recorded on phase 2 of lockdown, and you couldn't find any difference between those. So you're going to be able to read on the paper more detail about the analysis, but here I'm just going to highlight what were the key findings. So we did some statistical analysis, which Susie's were amazing and did a very good job on it. And she controlled the variables for social demographic and health outcomes that I'm listing here. And we used in the model sitting time, and we noticed that 42% of our depression score could be explained by these variables. And the same 27% of the well-being score could be explained by the social demographic health outcomes and sitting time. Also, surprisingly, physical activity did not account to the variation in depressing score when sitting time was added in the module, which basically means that sitting time was the main variable that affect depression and well-being score. We also conduct a further analysis to look to participants who sat more than 8 hours a day, compared to the ones who sat less than 8 hours. And we found that 8 hours or more a day participants had 8 hours or more a day of high depression, had higher depression and anxiety score, and lower well-being comparing for those who sit for a shorter period of time. Okay, so we know from the literature that sitting time has a negative effect on all-cause mortality. We also know that participation in physical activity can balance this negative effect. So this is what is really showing in this graph. So you actually want to be here on the green zone. So the longer you sit, so for example, if you sit for 8 hours, to compensate the negative effect of sedentary behavior on your health outcomes, you need to exercise for longer, so for about 60 minutes. So there is a lot of evidence coming from the literature about the balancing between the two. And if you sit for longer, you should exercise for longer to balance this negative effect. So our study actually found that physical activity did not promote this compensatory benefit of physical activity. But again, we just looked to mental health and we didn't look to the physical outcomes or other outcomes. So in our study, we find that sitting time has a positive, reducing sitting time have a positive effect on mental health. And we recommend that public health should encourage reduction of sitting time for mental health benefits. So now pass to Rebecca Elliott from Kirklees Local Authority, who will talk more about mental health and COVID-19 pandemic, the burden and the mitigation strategies. Thank you.
Thank you, Liani. I will just share my presentation. I'm hoping you can see this. So thank you very much. I just want to say thank you to Huddersfield University colleagues for inviting me to come and speak with them tonight. It's really great to be here. My name is Rebecca Elliott, as was said earlier, and I'm a public health manager at Kirklees Council. I was born in Kirklees, I live in Kirklees, and I work in Kirklees, so very much a local to the area. So what I'm going to go through tonight, hang on a second, it's just not moving on. Bear with me one second. Here we are. So what I'm going to cover this evening is how has COVID impacted on mental wellbeing in Kirklees. I'm going to talk briefly through some of the actions that we've taken locally to mitigate some of the negative impacts of COVID on mental health in Kirklees. I'm also going to touch upon suicide prevention, and some of the priorities that we have within our suicide prevention agenda currently. And I'm going to end with a bit of an example of public mental health in action from Kirklees. So I wanted to share with you this slide. I really like this slide taken from Hertfordshire Council. It demonstrates the mental health impact of COVID-19 across the life course. So I'm sure all of us on the webinar can find ourselves within this life course. And just particularly picking out some groups that may have been particularly impacted during COVID that may not have experienced mental health distress or feelings before. And Susie touched upon this within her presentation. So particularly the impact of parental stress. We know that working parents who've also been trying to homeschool during the last 18 months have been particularly affected. Also young people who've been away from their peers, who haven't been able to take their exams, and concerns over the impact on their future career paths. And as we've all seen in the media, the impact that it's had on our frontline workers who are always under stress, but particularly more so during this COVID-19 pandemic, and particularly those frontline staff working in intensive care units. Also the stress and grief placed on those people who've potentially unexpectedly lost somebody who was pre-COVID, otherwise healthy, and the impact that the restrictions on our funeral arrangements have had on people and will continue to have on people going forward. So I just wanted to touch upon these three groups, and this is kind of how we've been looking at it within Kirklees. I've taken this from the Centre for Mental Health. So we have like a COVID suppressed group. So these were people that were known to our mental health services pre-COVID, who currently ceased or postponed their engagement during COVID. And we did actually see this in Kirklees. We saw a drop off from people when we went into our first lockdown. Numbers did drop in terms of people that were already accessing services. And as it says here, we are now seeing people pick up, but their mental health state could have changed or deteriorated during that time. So an example of this could be carers, for example, who might have been accessing caring support or carer support pre-COVID, and then had to take more time to care for their loved ones and weren't able to access that support that they were accessing before. We've got a COVID generated box. These are people who are not yet known to any services, whose experiences of COVID have caused them to develop a degree of mental illness. And we have seen this in Kirklees. So we've seen an increase in people attending what we refer to as our crisis services, and our drug and alcohol services also saw a spike in people accessing them for help. And the most important thing here is that these were people that were not previously known to mental health services. So this is like a new cohort of people. We've also got a group of people that fall within the COVID altered interventions. So service users in this group have remained in contact with services but have received a changed intervention. So we have some commissioned voluntary community sector organisations in Kirklees that provide low-level early intervention and prevention support for mental health. And most of them, well, all of them, in fact, moved their interventions online. So for some, this will have worked well. No having to sort of take that first step through the door, for example, but for others without digital access, this may have increased or exacerbated their mental health challenges. Susie and Leanne have touched upon this already, but I just wanted to re-emphasise the fact that we have large mental health inequalities in Kirklees. We know that nationally, people with serious mental illness still die 15 to 20 years earlier than those people who don't live with a serious mental illness. And that is something that, whilst we are making great strides with mental health, there's still a lot of work to do. And what COVID has done has disproportionately affected the following groups. So as you can see here, people from ethnic minority communities, young people, those with an underlying health condition, and those living in deprived areas, and those living in poor housing conditions. We know that 75% of all mental health disorders start before the age of 24, which is why it's really important we take a life course approach to the prevention of mental health problems starting in the first place. We know that those people living in Kirklees that are living in the more deprived areas are significantly more likely to report having a mental health condition. And we also know that even before COVID was here, we know that to really tackle mental health problems, we have to take a wider determinants approach to mental health to improve population wellbeing. So just touching upon some of the actions that we've taken locally during the last 18 months to mitigate these negative impacts. So we moved existing support services online. We're going to share some information about our Working Together Better partnership for mental health in Kirklees, which is our early intervention prevention services that I mentioned earlier. So they did a fantastic job of moving things online so that current service users could keep in contact as much as possible, and in fact it has brought about some benefits for certain people. So it's about the positive legacy that COVID may leave, and what things do we want to continue with post-COVID. The council mobilised lots of staff to work differently at place level, working out in communities, doing community engagement, trying to provide reassurance to the public, having conversations, helping them with access to testing, etc. So there was a lot of mobilisation of staff going on during this time. We commissioned a regional grief and loss service in anticipation of the future demand and need of people losing people to COVID. And in fact, that's still happening now. That's still there now, is the West Yorkshire and Harrogate Grief and Loss Service. And Kirklees has had, in fact, the second highest number of calls during the time that's been there. So it's really good to see that people are accessing that support. We've added capacity into local bereavement support via our Kirklees Cruise service. So again, trying to anticipate that more people want to speak about their loss and take proactive steps to help them cope during this time. We've also commissioned a 24/7 mental health helpline in partnership with other areas across the district. We trained community response teams in mental health awareness, recognising that some of them may not feel confident in having those conversations. So in fact, it has improved lots of our staff in the council. It's improved their understanding around mental health and how to have some of those difficult conversations, and more importantly, where to signpost people to. We provided direct communication to the shielded population around what mental health support is available. Really recognising the strengths of the VCS sector, we could not have responded to COVID in the way that we have done without recognising the strengths that sector brings. They really know the communities, and they've really done a fantastic job, and we need to maintain those strong links going forward. We have some mental health support cards in Kirklees. We distributed these across communities, thinking about those wider social determinants of health, so distributing them within food banks and job centres. We supported the uptake of vaccine amongst those living with serious mental illness by providing transport and things like that. And what we're now trying to really think about and work on is how we understand how we can make the existing services that we have more culturally accessible, recognising the inequalities that have been exacerbated. So I just wanted to talk very quickly about suicide prevention. Something I get asked quite frequently at the moment is, have our suicide rates increased during this time? And this is something that we monitor very closely in partnership with West Yorkshire Police. So whilst we know that more people are feeling distressed and in mental health crisis, what we can say is that we are not seeing an increase in our suicide numbers compared to previous years. Currently, I'm not to say that won't happen, but we are doing everything that we can to try and let people know that there are things in place, and trying to increase conversations for people before they reach crisis point, because we know that if people take steps before they reach that point, they're more likely to be able to cope and move on. We have a multi-agency action plan in place in Kirklees. It really is very much like a jigsaw, and everybody comes together to play their part. There's no single organisation that can take responsibility for suicide prevention. So I've mentioned that we work very closely with the police to monitor the data that comes through, and that's around our suspected suicides on a weekly basis. What I really wanted to draw people's attention to, and almost encourage a bit of a call to action for everybody on the webinar, is to undertake what is known as the Zero Suicide Alliance training. It only takes 20 minutes. It's for anybody. What we really want to do is increase people's confidence in asking about, do you feel suicidal? People still are frightened to use the word suicide, and we need to get away from that, because we know that people who are feeling suicidal feel isolated and lonely. So by asking that question, you automatically, you're releasing and allowing that person to open up and say, yes, I do. So I do really recommend people taking the training. The link is there, and it's the feedback that we've had on it is really great. So please do that. The only thing I would say with the training is that if you've been recently bereaved by suicide or impacted by suicide, that I would perhaps not undertake that training for 6 months or so, or until you feel in a position that you were able to do that. We also have a West Yorkshire and Harrogate suicide bereavement service, which we can share details of tonight. Really want to encourage people and let people know that that's there. Postvention is the term that we use when you have been affected by suicide, or you have lost someone to suicide. And postvention is prevention. So by supporting people who've lost someone to suicide, we are actually actively doing suicide prevention work. So we have a fantastic service in place. Everybody who works there has lost someone to suicide, so they really know what it feels like. And yeah, I can't speak highly enough of that service. So please access and have a look at them as well. So just very quickly about public mental health in action. So we take a bit of a three-pronged approach to public mental health in Kirklees by taking a promotion, prevention and recovery angle to everything that we do. We know from our engagement during COVID with communities that what matters to people around their well-being or to help them maintain their well-being is feeling physically good, having good employment, so not just being in employment, but having good employment, having stable housing, stable finances, and having a good support system around them in terms of friends and family, community supporting each other, confidence, our feelings and our emotions. So some of these have been strengthened during COVID. Some of them have been tested. So in Kirklees, we've had reports of a higher sense of community, a sense of belonging to a community, which may have been missing before. We've also had a sense of people helping each other out more, and a bit of a almost like we're in this together, which is for some people almost helped their well-being. So I think it's about how we really take some of these good things forward with us as we recover. And I just think it's really important to say that good mental health is not just the absence of a mental disorder. It's a state of well-being where we are able to cope with the normal stresses of life. But however, as we know from the previous speakers, we're not all at the same starting point when it comes to this. And that's what we've really got to try and strengthen. So just to end, we do not want to lose good work that has taken place during these challenging times. We want to put back the elements that people have missed, and we want to continue to develop more responsive and collaborative pathways, because what this last 18 months has told us is that we can move quickly with things, and I think that is something that we want to continue with. I just want to finish with a video which highlights some local work that has taken place recently in Kirklees called Wellness in the Woods. And in terms of what we've just talked about, in terms of what matters to people for good mental health, it's not always a clinical service. And in fact, we need perhaps more options for people that aren't clinical. So this is a joint project between the council, Eden's Forest and Community Links. And I'd just like to end by sharing this as a really good example of public mental health in action. Thank you.
It'll be my 4th week, yeah, and it's been beneficial to me and my family, especially my family. They've noticed a big difference in me attending these sessions. I've been a lot happier in myself.
It's been absolutely brilliant. The lockdown has just gone on too much, and if it weren't for this, I don't think I could have got to this stage.
It's made a lot of difference to me. I've calmed down. Well, I've never been angry, but what I've been through, it's calmed down. Met new friends, and Mark, you guys are brilliant. So yeah, and I've enjoyed it.
I thought I'll give it a go. I'll last 2 weeks, and it's the best thing I've done for donkey's years.
Yeah, it's good. The guys are really nice. They're really welcoming. Having a good bit of banter, getting to know people, and yeah. I've got a lot out of it.
Yeah, it's made a huge difference. It's like an escape from your solitude. It's marvellous.
Very good. It's helped me a lot. It gets me out. It gets me some fresh air and some exercise. It's not just, and it helps you mental. It gives you an up. It's the talking to the other guys. Their past experiences, my experiences, and just letting things offload and putting your mind on creating things in the woods, and nature, the nature part of things. It helps a lot.
It's something that we look forward to now. I know it might sound daft to other people, but this is everything to us, coming here.
You know, this place really has done wonders with a lot of us.
I've been through things for 25, 30 years. And this is the best thing which I've ever done.
You find people that actually care, and you find people that actually
know what you're going through and know where you've been. You know, they're on the same journey. So it kind of makes you feel part of something.
Fantastic. Thank you so much for that really interesting presentations and discussion. It's really brought home to me the magnitude of the problem in terms of mental health that the pandemic's created, and also the scale of the task that's faced local authorities and still faces local authorities in trying to meet the needs of their community's mental health, especially given the inequalities that have been demonstrated, particularly during the pandemic. So what I'm going to do now is open up to questions from the audience, and we've got a few questions here. I'm going to start off with asking our panel. There's a query here. You identified differences in gender. Did you identify any differences in age in respect of who's most affected?
I might kick that off, Anne. Thank you very much. Yes, young people, young adults in particular, have been especially badly hit during the pandemic. And if we think about it, actually, there's three things that have happened to youngsters. So these, I suppose, teenagers up to the age of 24, it's been a triple whammy. Their education has been curtailed, the job prospects have diminished greatly, and they've had reduced social contact with their peers over the past 18 months. We also know that the period between ages 18 to 24 is a time of especially high risk for experiencing a mental health problem. 3/4 of mental health problems arise before people are in the mid-20s. So yes, it's young people, they've had it really, really tough.
Okay, thank you. Thanks, Susie. A second question we've had here is you touched on things that people can do to sort of support their mental well-being. Can you give a few more hints and tips perhaps on things that people can do to try and reduce stress or maintain their mental well-being?
Yes, absolutely. I know it sounds like a lot of hard work, and actually it is, but it's worth doing. The first thing I would say for somebody who's experiencing stress is try and pinpoint what it is that's causing that stress. You might not be able to do anything about the stressor itself, but knowing what it is that's causing those uncomfortable emotions and physical sensations can actually be really helpful in and of itself. Also, being able to identify whether you can do something about the stressor or not will give you a route forward for sort of trying to cope and deal with what's facing you. So in other words, identify what's causing stress and take appropriate action. It is hugely important that we build strong, positive, supportive relationships. So rely on your friends and your family. Ask for help if you need it. And it sounds like an awful lot of hard work, but trying to maintain a healthy lifestyle, making sure that you're sleeping well, that you're eating well, that you're getting exercise, getting out into the fresh air, reducing your sit-in time, trying to avoid those unhealthy coping strategies, those things that we might just fall into, drinking too much alcohol, maybe smoking too much nicotine, eating unhealthy food. Really, in the long run, even though in the short term it might make you feel better, in the long term it's going to have negative consequences for your mental health. Stay focused on the positive, try to avoid the negative. This is what I was saying, try to reduce social media use and try and reduce negative news consumption, because our brains get saturated with negativity and that will impact our mental health and how we feel.
Lovely. Fantastic.
Can I just add something?
Of course, can, Leonie.
It's something that we found also in our study that I didn't have a chance to speak. We look in more detail about the physical activity and the ones that really try to reduce the depression score. And we found that gardening and leisure time were the best physical activities for mental well-being. And that's something that already the Becky show on her slide too. I think that Wellness in the Wood is a lot about access to green space. And there is a lot of evidence that access to green space can improve mental well-being.
Okay, thanks very
Can I
much.
just come in there as well, Anne?
You can, yeah. Of course you can, Rebecca.
We're all answering this one, aren't we? Yeah, it was just to echo what everybody said, that sometimes taking up a new skill or learning a new hobby is like that mind distraction technique. But I think also as well, stress is a normal physical reaction, but it's being able to recognise when that becomes prolonged or whether you've not had a break from that stress. So I think it's really difficult, and I think we're quite bad at this, aren't we, in terms of recognising when it's becoming prolonged. And I think recognising that, so increasing people's self-awareness is like the very first step, I think. But there are services out there, and I think it's just taking that first step. And once you've done that, you know, you'll feel the difference.
Yeah, just kind of tied in with that, we had a query just for some sort of clarification around the stats that were presented. Was it suggesting then in the data that there was a protective effect of physical activity in respect to people's mental well-being during the pandemic?
Yeah, we actually did all sorts of analysis, and that was a surprise finding. We actually couldn't find this association between increasing physical activity and reducing the well-being, improving the well-being scores that we are looking for. However, as I said, we're just looking here to one particular outcome in a particular population. I would never recommend, I would never say that physical activity is not beneficial, which we know it is. And also, what I think the data is showing is that breaking sitting at times is very important. So if you move from sitting time to light physical activity, that's what actually try to improve your mental well-being. Because in this study, we compare sitting time with moderate and vigorous physical activity. So it's a stage beyond. We are missing the light within. So it seems that this light physical activity is something that can benefit your mental well-being. And I just want also to say that our data was self-reported, and we didn't really record of a type of sitting behavior that people were having. So we don't know if it's watching TV or spending time on social media or working hours, which one would have a more negative effect, and would be interesting to explore that. So the message is try to reduce prolonged sitting times, even if to walk to getting a cup of tea, or to walk quickly to see your washing or something like that. That appears to help specifically on that particular time when you're completely locked, which was phase one of the lockdown.
And I guess that's going to have implications if we move to a model where more people remain working at home. So that kind of segues nicely into another question here, which was, did we miss any chances to improve mental health, improve mental well-being, support people's mental well-being during the pandemic, and kind of what do we need to do after the pandemic? And I wonder, Rebecca, if you want to chip in there first, maybe.
I mean, it's really difficult. None of us have been through this before, and certainly when the pandemic started, the pressure that we were under, thinking about how we respond in the best way to make sure that we don't miss anybody, and then we get communication out there. It was very much all hands on deck. So undoubtedly, when we do pause and look back and reflect, I'm sure there will be things that we think if we'd only done that. But I think hopefully I've highlighted throughout the presentation that actually we've learned lots of fantastic ways of working during this time that we want to keep. Lots of place-based working, really getting to know our communities better. So I feel like there's some really good legacy things that we want to take with us. And we've done so much engagement with communities as well, to get that feedback around what matters to them, how they've been coping, and trying to do more outreach in communities as well.
Thanks, Rebecca. Well, while I've got you with an open mic, can I put you on the spot again? We've got another question, which is about working between community hubs and voluntary sector and the local authorities. And it's been sort of highlighted that the voluntary and community sector can be very effective, but also potentially there's a risk of being taken advantage of. So what kind of models do we need in order to have the best and the most efficacious working between community and voluntary sector and local authorities?
Yeah, absolutely. I mean, we try to co-produce whenever we're doing things. So getting people from communities involved in planning, commissioning, helping them to have their say. So we try and take very much a working with rather than a doing to approach. So true co-production, if it's done well, shouldn't feel like anybody's being taken advantage of in any way. And we know from the 5 ways to wellbeing that volunteering and being involved in activities in communities is actually very good for well-being. So hopefully, if it's done well, it has that sort of reciprocal advantage to the people involved as well. But obviously, we're always looking for how we can improve and taking on feedback. So that's kind of what I would say to that question, Anne.
Okay, lovely. Thank you very much. This is an interesting one. If people have to sit for a prolonged period of time, so I guess this relates perhaps to people working from home, what are the steps they can take to mitigate that or to compensate for that? Don't know, Liani, if you want to kick off on that one.
Yeah. So the evidence on seating time and health outcomes is becoming stronger for physical health, back pain, and other problems. So there is, I would say, particularly using standing desk, try to have breaks. Maybe some of you have these Fitbits that remind you that you need to do 250 steps every hour. So strategies like this, having a break between meetings and going for a walk, a little bit of fresh air in the garden, that can help. And of course, I find particularly helpful at the end of the day to have a proper exercise outdoor to refresh. But I think trying to remind yourself to have breaking times every 1 hour is quite important for standing up and walking a little bit. I find in particular that even my brain works better if I have these breaks every 1 hour.
Lovely, thank you. We've got a question here about impacts on people with pre-existing mental health problems, and particularly those individuals who have dementia and their carers. Do we know what the kind of mental health impacts were for them during the pandemic?
I don't know specifically with regards to individuals with dementia or their carers, but certainly, and Becky picked up on this in her presentation, that during lockdown, many of the supports for people with mental health problems and other issues, such as one-to-one therapy, training courses, volunteering, and so on, they were curtailed, changed, or stopped, which will have had impacts on individuals with pre-existing mental health difficulties. But I don't know, Becky, do you know anything about dementia?
We have a dementia lead in the council, so I can't speak on behalf of them. But yeah, it's very much wherever we could, we've tried to continue with online provision. Obviously, throughout the pandemic, there's been times when things have opened up, and there's been various COVID rules in terms of what we could do for people who were accessing mental health therapy. And I know that did fall within one of the groups where there was almost like an exemption compared to the rest of the population, where things could continue if it was considered essential. So where it could, it will have carried on. But undoubtedly, routines have been impacted. Things have changed. So there is going to be some COVID recovery that we do need to work on for not just dementia patients, but everybody who's got a pre-existing mental health condition.
Perhaps take chair's privilege here and chip in with what I know about from some of the nursing homes research, during the pandemic. I mean, obviously in the UK, in England, people living in nursing homes, care homes, their ability to be visited by relatives, family, friends was very, very heavily restricted. And there is some evidence that suggests that kind of isolation and lack of contact and obviously limitations in the extent to which care workers were able to provide the sort of level of stimulation that they might otherwise have had. There are suggestions in the literature that has had a negative impact on people, particularly people with dementia. So yeah, I think it is an area of concern. So And our last question here is a method, well, not a methodological one, a research one. So I'll hand it over to Liani and Susie. And that's about how do, as a researcher, people go about getting training to undertake the kind of research you're doing, and particularly if you're looking at people who've got long-term mental health problems.
So do you mean the Susie, I'm not sure if okay. So it's the person want to be trained for to become a counselor or something like that?
So if you want to be undertaking research in this area, so what sort of training do you need as a researcher to be able to do the kind of research you've been doing, looking at people's mental health or long-term mental health needs?
Susie, if you could help me with that. What I would say is, I don't know, for students from the university, for example, we always give opportunities, like Matt had an opportunity to work on this project with us. I'm not sure how it would work. I think maybe local authorities sometimes promote evaluation of their service and might be looking for people like that. But considering training, Susie, do you have any training for research in?
I think it probably depends on what stage in somebody's academic career. If you've not done a degree before, then as a psychology graduate, I would say psychologists are trained very well in research methods and data analysis, whether it be numerical or verbal. So do a psychology degree, that will set you up. If you've already got a degree, that there will be master's degrees in research methods and advanced analysis that will set you up for this kind of work.
Fantastic. Well, I think I need to bring the questions and answers to a close, unfortunately, at this stage. We're running out of time. It's been a really, really interesting discussion. And thank you for everybody for contributing their questions. Thank you to our presenters for their excellent presentations. I hope you found it interesting, and I think it's been a really important discussion.